Welcome, 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 everyone. Happy Transgender Awareness Week, and welcome to Community Conversations, Wellness and Justice in the Transgender Community. This is co-hosted by GLAAD and Arianna Center and powered by Gilead. I'm Raquel Willis, a consultant with GLAAD, and I'll be here with you alongside our amazing co-host, Daniela Arroyo from Arianna Center. So Daniela has an impeccable record as a prominent human rights activist, and she has been doing this work since 14 years old. She is a pioneering figure in the fight for trans rights in Puerto Rico, including the landmark lawsuit allowing trans people to update birth certificates, and is the first trans woman to compete in Miss Universe Puerto Rico. Hello, Daniela.
Hello, thank you for that introduction, Raquel. It's really nice to be here.
Of course, thanks for joining. So tell us a bit more about Arianna Center and how it serves the trans community, particularly in Florida.
Well, Arianna Center is a nonprofit organization that is dedicated to work with the transgender community and other intersections of the transgender people in the community. We provide services that help people achieve goals like name change. And also we do a lot of community outreach to see what are the needs of transgender people in terms of mental health and also physical health as well. So we try to do services that are holistic for the entire community.
Absolutely. And that is so key. I know one of the common ideas out there in society is that, oh, well, the trans community is so small. But that doesn't mean that we don't deserve access to all of our needs being met. And your work is just so important to making sure that that happens. So as we continue this conversation, we'll be mixing in some data as well. And we'll be telling folks a bit more just about some general stats about the trans community. So let's start. All right, so this is considered maybe the most basic of data. A study came out last year that estimated that there are 1.6 million trans people in the US. Now, this is quite likely an undercount, and we know that the census is working to accurately ask about and include gender identity in their surveys. GLAAD research shows that only about 28% of non-LGBTQ people personally know a trans person, or at least that's what they say. But by these counts, only 0.5% of the total US population is out and living openly as transgender. So these stats are so key just for folks to kind of get an idea of the fact that we are a real community, we do exist, and we're out here just trying to live our lives. Okay, so with that, we're going to give you a little bit of the landscape. So contrast that 0.5% of trans folks living openly against the record year of state legislation targeting trans folks. So we know that there are ongoing attacks, of course, legislatively against the LGBTQ plus community, but particularly in Florida, which has been a bit of a ground zero, it has the second highest number of transgender citizens in the US, and still just 94,000 out of 22 million. So that's 94,000 out of 22 million. I know I'm throwing you some numbers here, so take notes if you can. But 7 of these bills have been passed into law, including restrictions on healthcare for trans youth and adults, and they are also targeting bathroom access. So take a look at some of these headlines here just to give you an idea. Of course, things are popping off in Florida. They're popping off, as you can see, in Missouri and Oklahoma. And it's really the work of groups like Arianna Center that is on the front lines of warding off so much of this harm towards the community. So Daniela, maybe hop in here and tell us about how this legislation is affecting trans folks in Florida.
I feel that when the community is becoming stronger and we make our voices be heard louder, we make ourselves be more visible, it's common for these conservative groups and the people that can really not tolerate us come up with these kind of lawsuits. I feel that the transgender community in the past 20 and 30 years have come so forward with the rights that we have gained and the fight that we have been doing, that this is something that could really take us a lot of steps back into that progress. And for me, it's very concerning because I transitioned when I was a very young person. I was 14 years old, and I personally know how important it is for transgender youth to have a transition that is fair, that is healthy. And I feel these lawsuits are not healthy for the trans youth at all. I feel that being scared to go to the bathroom or being scared if you will be able to have access to hormones or not on time, because when you're young, it's very important for you to start on time so you can prevent certain things in your transition and make it easier. I feel this is something that makes a very unhealthy background for that youth. And that's really what makes me the most concerned, because I lived this experience myself at some point, and I know how important it is to have access to rights.
Absolutely. And thank you for just being vulnerable and sharing your personal experiences. That's why the work that groups like Arianna Center, GLAAD, of course, and on is so key, because we need to be making these interventions in media so that we can tell our own stories on our own terms. We don't need anybody telling the trans experience for us. Honey, we got this. I want
Thank
to
you.
ask another question too, because you talked about how the attacks have impacted, of course, individuals, but how has it impacted the work of Arianna Center?
I feel it puts us in a position um, that can be complicated because, yes, we want to help all these people, especially the young people. But when we are dealing with this kind of lawsuits and, we are at the risk of maybe being prosecuted if we do help people, it puts us in a very complicated position. And I feel it makes us be more gain more courage to keep fighting and do more for the community, because this is not something that I feel it's fair for nonprofits and the community to be at. It's not a comfortable situation to be. So I feel this is something that for us, we use it as fuel to keep doing the fight and just keep helping the people that need it, because I believe that it does pay off in the long term, keeping the fight no matter what is happening in the country and in the politics.
Absolutely. And I think you bring up such an important point as well, as like the trans community is not waiting to be saved. Okay. We
Mhm.
are doing that work. And part of the issue right now is that there are folks and there are forces that are trying to impede that pivotal work that we are doing on behalf of the community. So I'm going to circle back to that point, but let's hop to this next slide and just do a deeper breakdown on some of these bills. So as we have said, the number of anti-LGBTQ bills, state bills, have continued to rise, particularly over the last several years. And this year we have hit a peak of about 660. If we were wishing for anything, hopefully it would be just maybe 66, but no, 660. So we're in the hundreds right now. And even though we know that only a fraction of them make it to law, some are still being enacted, and have faced court challenges. Some have failed. We've been successful on others. But these efforts alongside this damaging legislation also act as avenues for sharing disinformation about the community. So sharing horrible, non-factual information about trans people's existence. And I'm sure we could go on and on about the different tropes out there that are not rooted in anything real. But that impacts people's lives, and it also impacts trans people's access to healthcare. So I want to make a nod as I kind of go into this next question, because one of the pieces that is so key to Arianna Center's work is working on supporting folks who may be more at risk of contracting HIV or who are living and thriving with HIV. But alongside that, we need to be having a more holistic conversation about healthcare. So yes, there's gender affirming healthcare. But of course, trans people are full human beings with any number of experiences. So when we're talking about reproductive justice, we need to be having conversations about trans access to healthcare. When we're talking about living with HIV, we need to be talking about how that impacts trans people's lives. So I want to ask you, Daniela, thinking about Arianna Center, what are you kind of seeing around how these attacks in Florida are maybe making it hard for Arianna Center to do the work that is so key in terms of testing and treating folks living with HIV?
I feel that when trans people are having to live in fear to access healthcare, it will be more difficult to give these services to them. And a lot of these anti-LGBT bills are trying to make it more difficult for trans people to have access to the healthcare that they deserve and that they need. So it definitely makes our work harder. Doing community outreach is it's becoming a process that is becoming also more difficult than it was before. And I feel it's because trans people are starting to be in fear again of maybe losing their hormone treatments if they have to go and do HIV prevention treatments, for example. Sometimes it feels like they are trying to choose between one thing or the other. And it's really becoming more difficult for trans people to receive these services.
So we're going to jump into talking maybe a little bit more about kind of the impacts of this legislation. So some of the bills that we know that is targeting the trans community, of course, one of the big ones is the Don't Say LGBTQ laws. Many may know as the Don't Say Gay laws, but we know it impacts so many more folks in our community. But alongside that, we're also just seeing that 86% of trans youth say bills debating their existence and healthcare have negatively impacted their mental health. We're also seeing 27% of trans adults who say they've moved to find a more accepting place to live. So just for a second, think about that. There are trans folks who have witnessed, of course, the increase in visibility. We've kind of seen strides made, of course, around marriage equality, and yet folks are still being displaced by how harmful some of this political rhetoric has become, and of course, these fights with the legislation. So that's really important for us to think about, Americans having to move to a different state to try and get the access that they deserve and feel safety and security. And then alongside those other two stats, 45% of trans teens experience cyberbullying and other online harassment. And we know that we have to be having conversations, of course, about suicidality. And then we're going to hop back into this conversation, of course, around HIV, particularly as it coincides with some of this legislation. So GLAAD research shows that 86% of Americans believe there is still a stigma around HIV, and particularly folks living with HIV. Gen Z is the most out and the most socially aware generation studied. Um, and they are also the least knowledgeable about HIV. And we could talk a bit more about that. I'm curious, Daniela, how that lands for you in terms of the lack of information maybe that is out there for Gen Z around discussing HIV, understanding how HIV can impact their lives.
Um, I feel that the youth is so focused on, not losing the rights they already have as trans people, that educating themselves about, things like HIV and other things that are important for our health as a community doesn't become a priority because they have to focus on this other part of, of their lives. And yeah, I do think that my generation is having more trouble having access to more information about HIV. Also, the fact that, we think that the disease is already, the epidemic is over because we have more medicines that we had 20 or 30 years ago, that maybe they don't see it as a as a threat anymore in the same sense. So I also feel that can also be part of the what makes the statistics be that high.
That insight is so key. I mean, I think it's real, I think maybe for millennials, we've seen kind of the waves, right? We know that the generation just before us really had the brunt of the threat of HIV and particularly not having access to the healthcare that they deserve, right? And so we lost,
Mhm.
huge chunk of our generation, particularly in the 80s and 90s. And so I think you're absolutely right. Like there's been some distance, and some of that is thanks to activists and advocates, thanks to groups like Gilead who have really beefed up funding and support for access to support for folks living with HIV. But then, of course, we're still living in a landscape where many folks are not having access to adequate sexual education, for instance, right? And then, of course, compounding that with schools and curriculums that don't want to discuss the fact that queer and trans people exist. I mean, there are just so many layers on top of that. So thank you for speaking to that, because I think that we don't talk about that enough. Um, and one last stat I'll leave with here before we hop into the next slide is just, we're seeing here people ages 13 to 34 account for 57% of new diagnoses. So we have to be having more holistic, expansive conversations around HIV, risks to contracting it, and of course, what happens when we do contract it, right? And we still have these beautiful, full lives to live. We're going to hop to another side, maybe a more positive side. There are more states that are actively moving to protect access to essential healthcare for trans people. So you see here, of course, we have the Maryland governor, we have Minnesota's Senate. So there are some strides happening here. And of course, in that, we're also seeing more understanding of the need for reproductive care as well for trans folks. And then we are also seeing an increase in the political presence of trans folks. We saw a record number of trans candidates running for and winning elected office in recent years. So we're going to show some of those leaders here. All right, and this is just a few. We have even more on varying levels across the country. But shout out here in particular, Olivia Hill of the Nashville City Council, Judah Largent of Corvallis, Oregon School Board, and Fabian Nelson of the Mississippi State, who is a Mississippi State representative. And these milestones are important because, as we were saying before, trans folks need to be able to tell our own stories on our own terms, but we also need to be respected as the leaders of our own lives and destinies as well. And so this is great.
Exactly, representation and being in a position of power. Our community has been used to being in a position of having, other people trying to take power over us. So it's very important for me and for the entire community to see these figures in politics, because it gives us, that sense of power and hope that we have more control of, how things are going to be working in society.
Yeah, I mean, with political representation as in terms of identity and of course in terms of values, we got to be clear about that. Alongside the work that grassroots orgs like Arianna Center is doing, and of course you, Daniela, as an activist and organizer, is doing, is so key. So we have, just to end off here, some additional resources for you. We have the GLAAD Media Reference Guide, which really has some specific breakdowns on so many different parts of our communities and the experiences of folks in our communities, including trans folks and non-binary folks, folks living with HIV, communities of color. And if you have any other questions, you can reach out to press@glaad.org. And then we also have the 2023 State of HIV Stigma Study. So check that out as well. And then, Daniela, I want to give you the last word. What is the best way that folks can support the work of grassroots groups and organizations like Arianna Center?
I feel becoming a volunteer, for example, is something that helps us a lot to, do more community outreach and provide our services to more people in the community. Also, being vocal, being a spokesperson for the community. Indirectly, it really is also something that helps us do our work as well, because yeah, being vocal, being verbal about who we are and that we are here is also very important for organizations like us.
Absolutely. All right. So you heard it from Daniela. Get involved, honey. All right. Thank you all for listening.